Hello, my name is Jarod Richards, and I'm a sports medicine orthopedic surgeon with U of L Health. So I didn't grow up in a family of nurses or doctors, but I did grow up in a family of educators. I distinctly remember the first time I ever saw an orthopedic procedure. It was a local surgeon treating an ankle fracture, and he plated it, and it was the absolute coolest thing that I've ever seen in my life. And I was hooked from that point on. I knew exactly what I wanted to do, and I've been happy ever since. I know that orthopedic surgery is what I'm meant to do in this life. So I'm a fellowship-trained sports medicine orthopedic surgeon. I was really fortunate to get to train in my fellowship under some world-renowned cartilage surgeons who themselves developed a cartilage preservation system that had increased cartilage cell viability. What that means for patients is that the cartilage we transplant into their knee or wherever else gives them the greatest success for a good long-term outcome. So I believe in a patient-centered approach to their clinical experience. And what that means is that we really focus on education, communication, and shared decision-making. When a patient comes into my office, I'll take as much time as necessary to hear their story, understand what happened to them or what's going on with whatever injury they have, do a physical exam to find any positive findings, and then really go through their imaging. And I talk them through every step of that process by showing them their imaging, pointing out where I see any tears or injuries to soft tissue or bone, and then using models and other educational tools to help describe that problem. And then we run through the gamut of non-operative and operative treatments to treat their given condition. And we come to a decision collectively on what we think is the best stage going forward. So I always knew that I wanted to return back to U of L Health at the end of my training, primarily because it's affiliated with an academic institution. That offers us the most cutting-edge treatments in the industry. This, after all, is the system that performed the first US-based hand transplant and the first artificial heart transplant here at Jewish Hospital. So because of that, I've got my access to cutting-edge treatments is unparalleled. I can apply that to my cartilage transplant practice and also to my joint replacement practice with robotic-assisted joint replacement that allows me to really tailor the implants to the patient's needs in a minimally invasive fashion. My wife Katie and I have a 3-year-old named Molly and a 4-month-old named James, in addition to a 95-pound Weimaraner dog named Ender. And when I'm not at work, I'm doing as much as I can to be with them as much as possible. We try and spend as much of our time as we can at the Olmsted Park system here in Louisville. We love going to Cherokee Park and walking around Cherokee Park. And my kids keep me busy for the most part.